Hello, my name is Dr. Eugenie Hsu, and I'm a licensed clinical psychologist. I've also been an avid practitioner of EMDR therapy for the past 26 years. In 1994, I was fortunate enough in that I was able to receive EMDR training directly from its founder, Dr. Francine Shapiro. In 2009, I also received training from the Humanitarian Assistance Program to provide EMDR education and training to mental health professionals in Sichuan, China following the earthquake of 2008. In this video, I hope to explain EMDR to you, my prospective or current clients. You will learn about how EMDR works and what to expect from EMDR treatment. In this video, I'll be covering several topics, starting with describing how EMDR works. I'll also go into who is a good candidate and who is not, the goals of EMDR, including session goals as well as overall treatment goals, how to choose an EMDR target for processing, and how to choose one if the trauma is complex, and finally, what typically happens in EMDR treatment before, during, and after an EMDR session. So, what is EMDR and how does it work? EMDR stands for Eye Movement Desensitization and Reprocessing, and it is an effective and efficient, evidence-based psychotherapy for trauma that helps to rapidly neutralize the distressing symptoms caused by traumatic experiences. Processing focuses on selecting a key traumatic memory called a target that is believed to be at the root of trauma symptoms or problems. It was discovered by accident by Francine Shapiro in 1987 with eye movements, but it has since been found to be just as effective with any type of bilateral stimulation, whether that is through eye movements, auditory, or tactile stimulation. I used eye movements for over a decade, but have since switched over to auditory stimulation, which is listening to bilateral beeps on a headset. I personally find all EMDR bilateral stimulation effective, but I prefer the convenience of the auditory stimulation, which is available as a free app on a smartphone. There are theories of how EMDR works, but little is understood about its neurological mechanisms. If you're curious, you can read the published research literature. I recommend using emdr.com as it is a very comprehensive website with thorough resources. However, it isn't necessary to understand how it works in order to benefit from it. You can even be a skeptic. For my purposes, to help you understand EMDR and evaluate your appropriateness for this treatment, I will focus on describing it using metaphors that I've developed over my 26 years of experience treating patients with EMDR. My first descriptive metaphor I call the garden metaphor, and it answers the question, how does EMDR treat psychological problems? So, using this metaphor, think about your life as a garden. If you take good care of your garden/life, you will hopefully end up with a pretty nice garden/life. But maybe you ended up with clay soil that was already in your garden, and that can be symbolic of the genetics and family history that you inherited. Or maybe there were some bad years with a drought or an insect infestation. And these are, of course, symbolic of environmental problems that you also cannot directly control. So trauma-based problems are like weeds growing in your garden, since you did not invite them into your life. If we think of them as a weed growing in your garden, how would you get rid of them? Well, a gardener would dig out the weeds by the roots so they can't grow back. And similarly, an EMDR therapist would dig out the root of the problem, which is the trauma experience that started the problem in the first place. This trauma experience becomes what we call the target to process. My second metaphor is what I call the spring cleaning metaphor. And this metaphor helps to answer the question, what happens during an EMDR session? So if you clean out a closet, you have to spend time at the closet examining items and deciding which ones you want to keep and which ones you want to discard. During EMDR, you visit your traumatic memory and you encounter the thoughts, feelings, images, and associations, etc., that are connected to that traumatic memory. to that target. You may find that some of these are non-adaptive, so you might find yourself remembering or thinking it was my fault that I was abused. You may also notice that some of these thoughts, feelings, and associations are more adaptive, such as, I was so young, how could that abuse be my fault? Just as the closet gets cleaner as you go through the items and sort through them, your attitudes, thoughts, and feelings become more adaptive as EMDR processes these traumatic memories. It is not clear how or why this happens, but I assure you that after 26 years of doing EMDR, I observe that the natural tendency during EMDR processing is to move toward a more adaptive, mature, and self-compassionate attitude about the trauma experience. The next metaphor I'd like to describe is what I call the non-stick pan effect metaphor. And this helps to answer the question, how will I react to my trauma triggers after EMDR treatment? So in addition to the reduction or elimination of PTSD symptoms and the reduction of the emotional charge that's associated with your target memory, there's also the non-stick pan effect. Even if EMDR is successful, your triggers, like hearing news about violence or sexual abuse, those triggers will unfortunately still be around. However, if you have EMDR, you will react more like a non-stick pan, and these formerly triggering stimuli will not affect you to the degree that they did before EMDR. What factors make for a good EMDR candidate? A good EMDR candidate has the following. Number 1, a post-traumatic stress disorder diagnosis, or at least symptoms and problems that are directly and causally related to traumatic experiences. For example, low self-esteem may be treatable with EMDR if it is causally related to physical and emotional abuse, for example, even if the patient does not meet diagnostic criteria for post-traumatic stress disorder. A good candidate also has a target memory that is easily identifiable and consists of conscious memories that are emotionally and palpably painful to recall. Number 3, an ideal patient also has had some talk therapy already to understand his or her emotional relationship to the traumatic material. EMDR processing can be intense, and EMDR is not the best time to first encounter these intense feelings or experiences. And lastly, a good candidate has self-soothing and grounding skills and other supportive resources to help manage feelings if the traumatic material is complex and requires more than one session. What factors make for a poor EMDR candidate? A poor candidate has the following. Number 1 is current life crises that cause a patient to be unstable or have poor coping and self-soothing skills. Although EMDR processing can work quickly, there's still a chance that painful material may surface, so it is important for the patient to have adequate coping skills or be stable enough to manage these painful feelings that can emerge from EMDR. For example, untreated bipolar disorder, poorly managed chemical dependency, risk factors like suicidal depression or active psychosis can make it difficult to manage the stress of doing intensive trauma treatment. Also, insufficient emotional pain connected to the target memory. The target memory has to arouse some sufficient distress in order for it to be desensitized, so it isn't helpful to try to find a target that is not emotionally painful enough. Third, ongoing trauma, or what I call ecological factors. It is not reasonable to reduce PTSD symptoms by processing a past trauma if a patient is still living in dangerous conditions in the present. For example, using EMDR to treat a traumatic memory from 2011 for a patient who is currently cohabitating with a spouse who continues to be abusive would be ineffective, because it would be ecologically valid for that patient to continue to have trauma symptoms while currently living in a dangerous situation. Next is secondary gain or conflict of interests. It is also not recommended to do EMDR if there are pending lawsuits or disability evaluations, because that can result in an agenda for the patient to stay symptomatic. And lastly, it's not recommended if the causal relationship between the symptoms and the trauma is questionable. EMDR is effective for trauma-based problems, but it is not a silver bullet for all problems. Some patients have an unrealistic expectation that EMDR can solve all psychological problems, but this is not so. What are the goals for EMDR treatment? There are two types of goals I'll be talking about. The first one is called the session goal, and the second is called the treatment goal. A session goal is defined as when do we know a session is complete or successful? There are three specific goals that we want to accomplish during a session. Number one is to decrease the distressing emotions that are associated with the target memory. Another way of saying it is to neutralize the power of the target memory. The second is to increase the strength of the positive cognition, or the confidence of the positive cognition. Positive cognition is rated from 1 to 7. So we start out with a low number and we want that number to be as high as possible, or as close to a 7 as possible. Third is to decrease the physical tension associated with the target memory. Most people who are traumatized will hold some physical tension in their bodies. So we do a body scan at the end, and we want to ensure that the patient's physical distress has been decreased as well. The second type of goal is called a treatment goal. And the treatment goal includes the following. Number one, to reduce the trauma-based symptoms, such as post-traumatic stress disordered symptoms, nightmares, flashbacks, intrusive thoughts, startle response, disassociation, avoidance, etc. Another goal is to change the person's core beliefs that are related to the trauma. Very often, people who've been traumatized, especially if it's complex or it happened earlier in their childhood or in their life, they carry around a lot of maladaptive core beliefs, such as it's my fault, or I did something wrong, or I'm worthless, or I'm full of shame. Those core beliefs can also be changed through EMDR. Thirdly is the reduction of the impact when faced with trauma triggers, or as previously mentioned, the non-stick pan effect. We want to have somebody not react as strongly or at all when they are faced with their trigger. So how is a target chosen for processing? And I know a lot of you may have questions about complex trauma. How do you choose a target if you have been exposed to prolonged and pervasive trauma? So to answer the first question is very easy to answer. When the trauma is simple, and by simple I mean that there was a one-time occurrence, so one rape, one carjacking, one mugging incident, then the target selection is simply focused on that traumatic experience itself. That's very easy. Now, when the trauma is complex, there are also ways to narrow down the target. So these are the various ways of doing it. Number one is you want to choose the target that is associated with the problem that you're focusing on by looking at what was worst and then what was first. So what that means is, let's say you went through your repertoire of traumatic experiences and you came up with, let's say, the top 7. But you can't choose which one of the top 7 you'd like to process. They all feel equally bad to you, equally painful. What you would do is then choose the one that happened when you were youngest. So it's worst and then first. Another way is to select a target by looking at your schema or core beliefs. And you can also ask yourself, what are the thoughts that you have about yourself or the beliefs that you have about yourself that are really painful that you'd like to change? For example, you might tell yourself that you're no good or that you're not lovable. You can ask yourself, when did you first start believing these things about yourself? And what was going on in your life at that time? What were the traumatic events that were surrounding these beliefs about yourself? And that might also give you a clue about what targets you could process. Another way of narrowing it down is to group it by perpetrator. So if you've been perpetrated by different people, you might say, okay, I'm going to focus on, choose one on my ex-husband. Another person who was a perpetrator was my stepfather, etc., etc. So you would group it by perpetrator. And then you can also group it by type of trauma. So whether you had sexual abuse or physical abuse or car accident or medical trauma, you can kind of group it that way as well. And I know this is a little overwhelming when you have complex trauma. It's not always easy to prioritize or to pick which one you want to do. So don't worry, I can help you figure that out. We can work that out together. Okay, the next section is kind of a big section, so bear with me. This is a section on the phases of EMDR. So what are the phases of EMDR and what happens during these phases? I'll try to summarize. The first phase, of course, is no different than any other phase in treatment, which is history taking. So I'll be asking you questions in an intake interview, very much like any therapist would ask questions in an intake interview. I'll be getting your history, your symptoms, your psychological treatment history, etc., etc. I'll probably be listening extra hard for your trauma treatment because that'll be the main focus of our work together. The second phase is called client preparation, and you're going to be prepared by making sure that you have grounding skills, that you have a safe place, that is a safe place that you can go to in your mind, that you have some resources that you can utilize. These are internal resources. Don't worry, I'll explain more when we see each other about what those things are. I'm also going to be helping you narrow down on a target and the associated negative and positive cognitions. When we sit down and actually do the EMDR, right before we start the desensitization, the phase is called assessment. And that's where I'm going to be walking you through 7 specific questions that should only take a few minutes, but I will tell you what they are now. Number 1 is the target, and that is, as I said earlier, the traumatic memory that's closely associated with the problem or the symptoms that you have. The second is the negative cognition, and that is the negative thoughts or beliefs that you have about yourself when you think about that traumatic target. Oftentimes it's, I'm worthless, it's my fault, I didn't do enough, I'm unsafe, I'm in danger. Those are typical negative cognitions. Positive cognition is the next one, and that is the positive thought that you would prefer to have instead of the negative one. So oftentimes it's just the opposite of the negative. If your negative cognition is I'm worthless, your positive cognition would be I'm worthy. If your negative is I'm not safe, then your positive is I am safe now, etc. And I can help you with those in more detail. Then I'm going to have you rate the validity of your positive cognition on a scale from 1 to 7. So that means when you say the positive cognition to yourself, I'm safe now, how true does it feel to you when you think about that target memory? Usually people don't feel it very confidently at all when they're doing EMDR, otherwise they wouldn't need EMDR. So they would say, on a scale from 1 to 7, I'm safe now feels like it's about a 1. Okay, that's expected. Then I'm going to be asking you about your emotions. So how do you feel when you think about your target memory? So you'll report to me, I feel scared, I feel angry, I feel shameful, etc. Then I will be asking you to rate the intensity of those emotions using SUDS, which stands for Subjective Unit of Distress Scale. So that scale goes from 0 to 10. So I expect your number to be high. Let's say 8, 9, or 10 when we start. And then lastly, I'll be asking you to do a body scan to find out where you're feeling tension in your body or where you're holding it. So you'll just report to me, my stomach is tight, my chest is tight, etc. Okay, once those questions are asked, then we go into desensitization. And that is simply sitting and putting on the headset, and you'll be connected to an app on my phone. You're going to be hearing some clicks or some beeps to the left and right side of your ears, in your ears. And during that time, your instruction is really simple. You're just going to sit there, you're going to think about your target and the associated questions that I had asked you, and you'll just sit there and you'll listen to the beeps, and that's it. You're going to have the beeps on for about 45 seconds. Then I will stop and I'll ask you, what did you notice? And when I ask you, I simply want you to observe and report. So whatever happened, you just tell me. You cannot do this wrong. I really want to emphasize that. A lot of people have sort of performance anxiety around EMDR. They want to make sure they're doing it right. The only way you can do it wrong is if you lie to me. So whatever happens in those 45 seconds, you just report that to me. If it's a feeling you had or a thought you had or an image you had, even if it was imaginary, it doesn't matter. It's almost like wake state dream therapy. Just tell me whatever weird thing comes across. If nothing happens, that's fine too. It's all part of the process. So we just have to trust the process. So you tell me whatever it is that you notice. Let's say you say, I noticed ABC. I'm going to then report to you, let's continue with ABC. So you're going to continue thinking about the last thing you thought about, and I will proceed with the beeping. Another 45 seconds passes, and again I ask you, what did you notice? And this time you say, I noticed XYZ. And so I will say to you, okay, let's continue with XYZ. Now, during the process, on occasion, I will redirect you to go back to the original target because we will have traveled about a little bit. It's sort of like cleaning up that messy closet. We started with the first thing that we saw in the closet and we took it out. Now we're deeper into the closet. So every once in a while, I'm going to ask you to go back to the original target, and I'll ask you, what do you notice about the target now? And usually people will report that the target looks or feels different. And however you experience it now, I'm going to ask you to then think about that target, the new version of the target, and you may notice that it's less distressing. I will also ask you to give me a number. How distressing is it? Let's say we started at a level 8. What is it now? You might say it's maybe only a 3. I'll say let's just notice that it's a 3. So we'll kind of continue in this fashion, and the goal is that your target, the feelings associated with your target will go down as low as possible, hopefully to 0. The second goal, as I said, is to raise your positive cognition belief. So I will be also checking in with you about your positive cognition and how much you believe in that. That number will hopefully go up as high as possible, perhaps a 7. And then lastly, we'll do a body scan. I'll make sure that you feel calm and relaxed at the end of the session and no longer distressed with that. And then I will explain to you, that'll be the end of the EMDR for that session, and I'll explain to you to just notice any other thoughts or feelings that come up over the week or two before we talk on the phone again. And then we will be checking in by telephone. And that is the last phase, called reevaluation. Many people will be wondering, what can I expect after EMDR, and how many sessions will it take for me to accomplish my goals? So typically, after EMDR, especially when it's been a complete session where the distress was reduced down to a minimal number and the positive cognition was raised to its maximum number, and the person feels calm afterwards, people report feeling relief. They report feeling like a heavy weight has been lifted from their shoulders. Some people also report feeling very drained in the same way they might feel after they've exercised. It's a kind of a good drained feeling, tired from a big workout. After the session, some people continue to process the trauma through their thoughts or feelings or dreams that they may have. And other people report that the target memory doesn't cross their mind again. They just simply forget about it. They don't think about it anymore. And when they do think about it, it loses its charge and it becomes what I'll call emotionally irrelevant or easily dismissed. It's something that somebody can just sort of shrug off. During the reevaluation phase, which is the phase that is at the very end of EMDR, that's done usually 1 or 2 weeks after the session, I will call you on the phone and we'll go over the session together to make sure that we remember it the same way. If your distress was successfully lowered and your confidence in your positive cognition was raised, as is the session goal, I would say you completed that session successfully. I will ask you if these results persisted. That is, if you continue to feel neutral about your target memory. I'll also ask you about other changes that relate to your treatment goals. For example, if your treatment goal was to feel less distressed by being around angry people, I will ask you if you feel less triggered by angry people now. If your session was incomplete, that is, you did not decrease your subjective unit of distress and you did not raise your positive cognition, I will ask you about what you experienced during the session, and we'll figure out together what next steps might be taken. We could perhaps try another EMDR session to complete it, or we might decide to try a different target. Most people reach session completion in one session, but sometimes it takes multiple sessions to reach treatment goals, especially if trauma is complex. In closing, I hope that you now have basic information about EMDR and the EMDR that you may be experiencing with me. Please note that different people react differently to EMDR. So what I've described here may not be true for you. It's more of a general description of what typically happens to the patients that I've treated. If you have any questions, please write them down and ask me when we have our session together. I hope that the information that I shared here will give you useful information on EMDR so that we can use our time together to discuss your history and treatment goals, and if and how EMDR might be a useful treatment for you. Thank you for watching, and I will see you in person sometime.